combating nutrition disinformation and general bull. It's Jimmy Rants. JimmyRants.com.
What's up, you guys? Welcome back to another Instagram Live, and we have another Jimmy Rants episode in store for you here today. So sit back, relax, enjoy today's Jimmy Rants. JimmyRants.com is the website if you want to engage in the content that we talk about. And if you're brand new to Jimmy Rants, here's how it works. We start off over on Instagram Live, so go follow me at Livin' Low Carb Man, LIVINLOWCARBMAN over on Instagram. Then you can engage with me down there in the comment section like all these beautiful people who are coming in. Then you can watch on the replay there for up to 24 hours. And then after 24 hours, we house all of the videos that we do for Jimmy Rants on YouTube. So you can go access the Jimmy Rants YouTube channel and the all-new Jimmy Rants podcast, now available wherever you listen to podcasts. So what we do here, you guys, is we talk about some topic in the world of nutritional health, and I do a rant about it. So today's Jimmy Rants episode is all about health insurance and what it would look like and should look like for healthy people. So to give you a little context, I did not have health insurance for a little while, over about a 10-year stretch, because I couldn't afford it and I just couldn't get it. And so I tried to live as healthy as possible without the health insurance. And then when the Affordable Care Act was enacted into law, I was kind of forced into buying health care. And it was a good thing, because there was catastrophic type things that if something were to happen, that I broke my leg, broke my arm, twisted an ankle, and needed some kind of physiological care by medical people, it was nice to have that coverage. Unfortunately, if you're caught within the system of healthcare, you have to play a little bit of their games. And so if you go see your doctor and you're trying to keep an eye on relatively useful information for you. So, for example, I have insulin resistance. So I want to keep an eye on my fasted insulin levels. Well, my doctor won't run that because I'm not type 2 diabetic. And he says you have no reason to run those things. And so if you're generally healthy and you're in the system of having to use health insurance, it doesn't make any sense that you have to pay premiums, for example, which I pay for my policy. It's right at $500 a month to be able to be eligible for the Affordable Care Act. But I have yet this year in 2018, I've yet to use it one single time. I can't use it. Because when I go to see my doctor, he wants to push me on medications for lowering cholesterol. He wants to push all of these things on me. He doesn't want to run my fasted insulin. He doesn't want to run an HSCRP. He doesn't want to get all the things done that a medical doctor could do and could run through the health insurance plan. And so I think healthy people are kind of stuck these days with the system, because the way the system is set up is you're rewarded for being sick. You're rewarded for making unhealthy choices. And I think that's a bass-ackwards way of doing health insurance. I would think that you would want to reward those patients who keep themselves generally healthy. They don't go to the doctor over every little sniffle and cough and chronic health issue that pops up. They just stay healthy and they stay away from the medical care system. Obviously, they do a great job, like I said at the beginning. If you break your arm or do some other, if you cut your leg and you need it to be sewn up, they do a great job of fixing those things. What they don't do a great job with is chronic health problems. So treating type 2 diabetes, dealing with specific diseases that are all related to metabolism, and that get better when you start eating a healthy diet. So I want to know what health insurance for healthy people should look like, because I think there needs to be always kind of catastrophic care if things need to be taken care of, like the things I described, or if you get diagnosed with something that you just didn't know you were going to have. Okay, you got that insurance in place. But let's back up. Why aren't we talking about kind of preventative measures? And why, if you choose to eat a ketogenic diet, for example, why can't you get a discounted rate on your premiums, especially if they're checking specific markers to see that they get better? Why can't they look at an HSCRP, and if it goes down, you get a better rate on your health insurance? Because that's a key inflammation marker that without it being elevated, you're relatively healthy. Why can't they look at blood sugar levels? Why can't they look at triglycerides? Why can't they look at relevant numbers and then prorate your health insurance based on those numbers? Well, I know why. They make a lot of money the way they do it now, and they keep people sick, which keeps them in the healthcare system, which keeps making money. It's a circular argument that keeps going round and round and round, and nothing's ever going to be done about the system. So I'm proposing on this Jimmy Rants that health insurance for healthy people should be incentivized for, imagine that, being healthy. And so I pay a premium of $500 a month right now for my health insurance. So when you multiply that times 12, that's $6,000 every year that I have to pay for health insurance, which I get nothing for. Obviously, if something came up, it would be there for me, yada, yada. I get all of those arguments. But what I don't get is why, if I'm not being a part of the problem, sucking out dollars from that system, why can't we have a health insurance for healthy people where you're incentivized to be, imagine that, healthy? I don't think a lot of people look at their health insurance that way. I don't think they say, well, let me do every means necessary in my diet and lifestyle to be optimally healthy. I think people see health insurance as, well, I get to go to the doctor as much as I want, and he's going to make me healthy. And so we have a little bit of kind of a backwards way of thinking about this whole issue. And I'm hoping that sanity comes into play at some point where we look at some of these key markers, because they matter, you guys. They matter a lot. And if those markers matter, why aren't we taking those into consideration when we're looking at health insurance and how much you pay for it and the whole healthcare system? It's broken. I think anybody can recognize that. You can't go to see a naturopath and have it covered by health insurance. You can't go see a functional medicine practitioner and have it be covered by health insurance. You can't go see a nutritional therapy practitioner or some other practitioner who could help you with your diet, which would indirectly help you with your health. None of those things, which are all proactive steps in getting healthy, none of them are covered by health insurance. So if we're going to call it health insurance, we need to give power back to the consumer to decide, all right, those dollars I want to allocate towards my health coverage, my health insurance, my health care. I want to go towards things that are actually going to make me healthy. And so I think we're going to see a discussion about this, you guys, in the coming years. It's going to happen sooner than later, because we have far too many people that are sucking money out of the system for chronic diseases that could be fixed by diet and lifestyle change. And then we got people who have made diet and lifestyle change, and they simply cannot afford to foot the bill for everybody else when they made the effort to make themselves healthier, and all of those other people just are ambivalent towards it. So that's what I wanted to share with you guys in this Jimmy Rants. Let's see what you guys have to say. Hello from Arkansas, Miss Joette. Thanks for being here. Kimberly, thanks for being here. We, the healthy, pay for the less healthy. I used to work for BCBC, or BCBS, excuse me, and Cigna. We pay yearly like you, Jimmy, and we rarely if ever go. That's sad to me. I just threw $6,000 down the drain in 2018. And the one time that I went to see my doctor, he refused to run my fasted insulin level. He refused to run an HSCRP. He refused to run an NMR lipoprofile. These are all tests that I wanted to have run, and he just wouldn't run them. What good is it to have a medical professional and have insurance that would cover parts of your health care if they're not going to give you the care that you want for your health? Makes no sense at all. And you're right, Kimberly, we are paying for the less healthy. And I would say the people who are choosing to not do anything or care about their own health. That, to me, is what's most disgusting. Nancy Booth 7 says, as long as health insurance is for profit, it won't get better. If we go single source provider, it should change. I'm definitely not going to get into that debate. I don't necessarily think the for-profit aspect of it is the issue. I think if you have competition amongst various providers, that actually prices come down and you get better quality care. At least people can choose what fits within their budget and what would work. I'm not so sure a single payer system would make it a better system, but your point is taken that we can do things better than we're doing now. Creative Keto Cook says some sort of health savings account that allows you to use the money as you see fit for your health. And I do have a health savings account. I started that one last year for the first time and paid into it. You're allowed, I want to say as an individual, something like $3,700 that you can put into a health savings account. I might be high on that, so don't quote me on that. But it lets you put it into a health savings account, and it actually covers all kinds of things, even things you wouldn't think of as healthcare. I think toilet paper is on the list. Anyway, so I do have those discretionary dollars to use as I want for health care, but it doesn't get me around the fact that I still have to buy health insurance and get this coverage because of the law that was put into place that makes you do it. And what I want to know is, can we still get people who are healthy onto some sort of health insurance plan that rewards them for the better choices that they make? That's what I want to see vetted out. And you can make specific markers. All right, let's get their blood sugar down. Let's get their HSCRP for inflammation levels down. Let's get their insulin levels down. Let's get this, let's get that, triglyceride levels down. I think if you kind of vet out what those key markers are, that if they're within a really good range, then those people should get some kind of a discount for being rewarded for being healthy. And I know a lot of those kind of incentives are being put into policies because of total cholesterol levels, which we know are bogus. They're also being put in there about people's weight, which again doesn't always tell the whole story. So I hope that we have radical change happen to this entire system so that the healthy people can get the health insurance they need for those catastrophic events without breaking the bank and feeling like they're not really getting anything for the money they're putting in to the system. All right, guys, that's it for this Jimmy Rants. Thanks for watching, you guys. Thanks for being here. JimmyRants.com is the website if you want to check out every rant that I've done. Go follow me on Instagram Live. I try to do these twice a day. I missed this morning, but we got one in here at the end of the day. So you can watch on Instagram Live. Living Low Carb Man is my username, and you can watch for up to 24 hours on Instagram. And then we house them on YouTube, and after that, they go on to the all-new Jimmy Rants podcast, wherever you listen to podcasts. Again, JimmyRants.com. Well, that's it, you guys. We'll see you guys again real soon. Bye.